Hi, I'm Stephen Jackson and I'm doing Unit 5 Injuries in Sport.
Right, Stephen, so for P1 criteria, can you describe 4 different types of injuries associated with sports performance and their underlying causes? So, first of all, if you could talk to me about one type of injury, please.
Okay, well, the 4 main types of injuries are overuse, fractures, soft tissues, and serious injuries.
Right, so talk to me about overuse, first of all, describe what that is.
Okay, the overuse injury is like, for instance, in tennis, where a tennis player is using his elbow. That's what you call an overuse injury because his elbow is constantly doing the movement of the tennis racket in the ball and stuff like that.
Yes, that's a good example, but can you tell me like what overuse injuries are, so like what it is?
Okay, the overuse injury is where the body is constantly being used. It's overworking the muscles and the tendons in the muscle in the body.
Good. Now, second type of injury?
Fractures. This is like a broken finger or bone, which is the same. Fracture or broken is the same. It doesn't mean any difference.
Good, yeah. So can you give me, is there 2 different examples you can give me, 2 different types?
There's an open, closed.
Open and closed, yes.
Yeah.
What's an open fracture?
An open fracture is where the skin is being penetrated and obviously you can see the damage. And a closed fracture is where you can't see, it's just like a bruise. Or
So if it's closed, the broken bone's what?
won't penetrate the skin.
Okay.
Yeah.
So third type of injury?
Soft tissues. This is where like tendons, ligaments and muscles. This is usually due to common places like joints on overuses.
Good. Can you give me examples?
Sprains is one of them, where you can twist your ankle and you would need like the RICE treatment.
So can you tell me what that is, Rice?
RICE is like rest, ice, compression and evaluation. Elevate, sorry.
Elevation, yeah, good. So what does that mean, elevation?
Is where you lift the leg up to put it onto like the waist.
Good, yeah. So your final type?
Your final one is serious injuries, which is like concussion, back injuries and spinal.
Good, so what would a serious injury be?
Like for instance, if you like going swimming and you dive off the diving board and you hit your back on the back of the swimming pool, that's like broken back and that's a serious injury.
Good, so what do serious injuries normally cause?
They normally cause
So what could the worst case scenario of a serious injury be?
it'll like minimise and paralyse.
So paralysed, but if the worst case scenario, what else could happen?
Death.
So could die, yeah. Well done. So for P2 criteria, can you describe 2 types and signs of illnesses related to sports participation?
The 2 that I've chosen are asthma and heart attack.
Good, so talk to me about asthma.
Asthma is where it's a condition where like it's mainly due to young kids and older people where they're doing a sport activity and for some reason they have to stop and take asthma, which is in like an insulin, which is where to put thing, it's like a tube sort of thing where they can put it in the mouth, press this.
So what's it called? Do you remember? Is it
Insulin, no.
Inhale.
Inhaler, sorry.
Yep, good. So
The
inhale.
inhaler, they put that in the mouth and then they push, and then that'll give them like the breathing sort of thing to bring them back round. And then
So what does it do to the airways?
it clears the airways, so that makes them breathe more easier and more smoother.
Good.
And then it'll take them roughly about 5 to 10 minutes for them to come back round and then to join back in the activity again.
Yep, excellent. So can you talk to me about your second type?
The heart attack is obviously more effective in the sports, and if someone's having an heart attack, it's clearly shown because one side of the face will drop and they won't be able to lift their arms up and stuff like that. So it's clearly shown.
Good. And what might the cause of a heart attack be?
Smoking, the salt intake, alcohol, all the stuff that
Good.
are no good for the heart, basically.
Good. So if you had to just describe a heart attack,
Yeah.
what causes it? Do you think?
Mainly it's cigarettes and smoking and
Good. So what does it do?
it's damaging the liver.
So what does it do? So to do with your heart,
Yeah.
what does some like get clogged up? What causes the heart attack?
All with due to smoking and alcohol, it clogs up like fat, and then it blocks up the airways in the lungs and hearts. And
So in the heart, what does it block up? What's the ones in the heart called? In the heart,
I don't know.
veins and
Trees
arteries. Yeah.
Sorry.
So to cause a heart attack, they become what?
swollen and then blocked.
So blocked, and then that's when you get your.
Heart attack.
Yep. Good.